Good evening. Thank you for joining the Hong Kong U Public Health Information Session for the 2026 intake. So let me introduce ourselves. So I'm Dr. Wendy Lam from the School of Public Health, and I'm the Academic Program Director for the MPH Studies. On my left hand is Dr. Polly Wong, and she's the team Program Director for the MPH Studies. And then on my right-hand side is Mr. Alan. He is our administrative staff who is from the MPH office, who will also provide support for the application as well. So thank you for taking to join us tonight. So these are here outline for the nice session. So we will go over some of the key features of the our program. And then we will also talk a little bit about why it is important for the SAF accreditation as a benefit for you. And profile, and then we will go over the curriculum and then some of the procedures related to it, followed by the availability of the scholarship options. And if you have any questions during the session, while I'm going through the material with you, you can then the question at the chat box. We will try to answer your question when I go along to present. And also at the end, we also have another Q&A session, so they can also ask questions there as well. So let's look at the key features of the Hong Kong U program. So why you want to consider to study the Master Public Health degree, as many of the public jobs benefit from having a degree specialized in public health. And obviously MPH is one of the more widely recognized professional degrees in the public discipline. And our graduate gained a competitive edge because our program provides practical knowledge and skills that you require to be effective in practice in the field of public health. And also, Hong Kong is a top university region. As you can see, we rank first in Hong Kong, second in the Asia, and also 11th in the world by the QS World University Ranking in 2026. And also we first in Hong Kong, 6th in Asia, and then 33rd in the world according to the time highest Asian World University Ranking this year. And for our Hong Kong U Med, the Faculty of Medicine, we also rank first in Hong Kong, third in Asia, and the first by the World University Ranking. And also we are the first only SAF accredited program in the region. So that's why our program is attractive for you to consider. And also, our program is a quotable program, which means the Hong Kong Medical Council recognizes the MPH as a quotable qualification. And also, our student can be accredited on continuing medical education or other professional development points if they're appropriate. And here are some of the feedback from us who share their experience with you. So they're very positive about our program. And so look at what is SAF accreditation. So as I mentioned earlier, are the first agent and also the academic program in Hong Kong fully accredited by the USA's Council on Action for Public Health. This is the longest standing accrediting body of public health school and program in the world. And the SAF accreditation is considered as the benchmark of quality to vary and the program. So a SAF accredited program has completed a multi-level review and trying to meet the nationally agreed upon standards developed by public health academics and practitioners. So I mean, our program, which is a self-accredited program, is a very high standard program that is recognized by UN or other places in the world. And also, after you graduate from a self-accredited program, you will be eligible for the certified in public health exam and to obtain the CPH credential. And why this is important? Because some of the employment units will only open for graduate from self-accredited units. And also there are some ships that are only available for students attending only self-accredited school or program. So these are the benefits why a self-accredited program is important. So let's look at our current student profile. As you can see, this slide the intake over the years from 2016 to now, and so we have actually grown substantially. So currently we the current intakes we actually have 211 students, and in terms of the occupation profile across for the current cohort, so we have a student who have background in as medical practitioner or practitioner in dentistry, other healthcare professional in nurses, physiotherapists, pharmacists, and also other allied health professional, and also have students who actually work in the healthcare setting by administrative side or in social service, education, and the business sector. And we also have students who have currently work as in research institute, and also others who are working in the field related to healthcare occupation. And fresh graduate, we will have quite a number of students as well. And also specifically, we also have open our program for our current MBBS medical students who are taking enrichment year to join us. So this is the breakdown of the academic background of our current students, the current cohort. So as you can see, we have about 40% who actually had a degree in Bachelor of Science, and then we all have a substantial number of students who have a bachelor degree related to the healthcare professional, for example, preventive medicine, nursing, MBS as well. And then we also have some or have a high degree, master's degree or doctoral degree coming back. And also we have small numbers coming from other disciplines. So in terms of the career prospect after you graduate, this is the breakdown. You see, we have quite a number of our graduates who eventually begin to work for NGO social and organizations, and also are working in the government, for example, Department of Health, Center for Health Protection, but also some of them go back to mainland China and work at CDC, etc. And we also have about 16% who eventually join the academic unit. So they join university to work in the education sector. And then we have some who went to the commercial and industry as well. So in terms of career field, as you can see from the bottom left-hand side, so about half of them will be working in the field of medical and health service, and then the other majorities work in the scientific and research work area, and then plus others as well. So now let's look at the curriculum. So if you join our program, we base the program actually structured into 3 major components. So one component is taking courses, one component is practicum, the third component is capstone. So in total, you will be getting 60. In order to be able to graduate, you need to get 60 credits. And the majority of the credits actually come from the courses that include a total of 14 courses that you have to be required to take. 6 of them are core courses, which mean any of you who join the program must take these 6 core courses, and then another 6 concentration courses depending on which concentration you choose to study in. Then you need to take those 6 required concentration courses, and then plus 2 elective courses that you can choose from the list. And then after that, in addition to the courses, you also need to complete the practicum, which involve roughly 200 hours of practice in the field. And also you need to complete the capstone as well. So our program, we offer 1 year full-time or 2 part-time. So for overseas or non-local students, you only have a choice of 1 year full-time due to the visa situation. But for local students, you can choose between 1 year or 2 years. And for those who are joining us from the intercalated program, you also don't have a choice. You can only do a 1 year full-time study. So here are the list of the 6 core courses that you will take if you come to join us. So including these courses will provide the core competency, the foundation knowledge for you in order to be able to meet the quality of the accreditation. So that includes you need to learn the foundation of epidemiology, principle of public health, the core concept of health behavior and communication, core principle of leadership management and health policy and politics. And then, as I mentioned, there are 4 concentrations that you can choose that include health practice of primary healthcare, epidemiology, biostatistics, control of infectious diseases, health economic policy and management. So let's look at the epidemiology statistics. So this concentration is led by Professor Cowling. And for this particular concentration, we will provide comprehensive training in epidemiology and statistics to you that include learning skills, how to collect, manage, and analyze the data, as well as to interpret medical and health research data. So these are the learning outcomes that you will be expected to achieve if you choose this particular concentration. So because of the interest of the time, I won't go into details of each of the outcomes, but you can look at our website to actually read the details. So the second concentration is the control of infectious disease, and this concentration is led by Professor Leo Poon. And for this particular concentration, we take advantage of our recent methodological development in descriptive statistics, or mathematical modeling, and also microbiology concepts. And if you take this concentration, you'll be developing knowledge skills that are needed to understand the relationship between the variables associated with pathology, transmission, and control of infectious diseases. And here are the learning outcomes that you were expected to achieve if you choose this particular concentration. And the third one is health economic policy and management. So for this particular concentration, the concentration lead is Professor Chow Kwan. And in this particular concentration, you will focus on economic, political, leadership and management principle, and learn how to apply them to understand the healthcare system, and also using economic evaluation to study health policy and intervention. And also, this particular concentration, you will learn how to examine healthcare system, resource requirement, and core competence of healthcare leaders and managers. So these are learning outcomes you will be expected to achieve if you take this particular concentration. Then the last is the public health practice, primary health care. So for this particular concentration is led by Professor Dennis and myself. And so this particular concentration aims to foster to understand contemporary health practice based on the principle of comprehensive care, and also we adopt the whole of societal analysis approach to look at local public health issue as well as the global public health issues as well. And in this particular concentration, we enable students to focus on social determinant of health, or cover environmental health, looking at personalized care that integrate public health in order to provide a high quality patient-centered healthcare. So in this particular concentration, these are the learning outcomes that we expect to achieve. So this slide shows the concentration courses that you would you require to take if you choose that particular concentration. So for example, for public health practice, comprehensive primary health care, you need to take practice of public health, personal public health, a course focused on environmental health hazards, foundation of comprehensive primary health care, how to use data to implement comprehensive primary health care approach, communication comprehensive primary health care. And then for the epidemiology and biostatistics, as you can see, all the courses are related to how to on advanced epidemiology method and also a statistic methods as well. And then for control of infectious diseases, you learn about have the opportunity to learn about emerging disease and one concept of One Health, and also we have course focus on epidemic and endemic diseases. You also have a course on field epidemiology, infectious disease, infectious disease, public health, and risk perception and education as well. And for health economic policy and management, and you will learn about a course focus on accounting and financing, and then you have a course on health economic evaluation for public health, and also healthcare management. Also, you learn the risk for health and strategies in healthcare. So, as I mentioned on, in addition to the core course and concentration courses, you also choose 2-year courses as well. And so these 2-year courses can be any of the concentration courses that we offer by other concentration from yours, the one we choose. And also, in addition to that, here are a list of other elective courses that we offer as well. So we actually offer a wide spectrum of topics that can choose from. And then, as mentioned, there you are required to complete the practicum, and the practicum is to prepare students with a broad skills of the system method that is required to be practiced in the field of public health. And so you learn about the theory instances and you apply those theories in practice. And so in the practicum, each of our students would to demonstrate ability to integrate and synthesize and apply the knowledge and skills and learning classes to solve public health problems. And you need to learn to demonstrate the skills needed to function in a professional public health setting. So here's a list of the some of the practicum sites who are currently offer practice for our students. So this list is exhaustive. So we actually have many more other practicum site offer practice for our students. And then the last component is the capstone, which is a cumulative experience allow students to integrate the knowledge and the knowledge that you learn specific for your concentration. So the student will have to undertake a capstone project, and the topic will be approved by your assigned capstone advisor. So you'll be working with capstone advisor to develop your capstone project. And so at the end of your study, you need to submit a capstone report, which is usually consists of 1,000 to 6,000 words, and this report should be a high quality written product that is useful for external stakeholder, which means your product should be ready to be adopted by any external stakeholders who have taken in topic. So now let's look at the class arrangement. So all our classes, because we are trying to accommodate time and part-time students, so all our courses are actually run either weekdays evening starting at 6:30 and usually 2 to 3 hours each, or weekend usually Saturday morning. And we also occasionally we have some courses we also offer intensive courses as well. So for those who apply to study part-time, you may want to pay attention to the schedule. For the you may have to take some time out in order to complete the intensive courses. We can usually run for intensively for 1 or 2 weeks. And the venue, all the courses are actually offered at the Hong Kong U Medical Campus on Session Road, Popular. And the format is fair, and we also have a minimum attendance requirement for each course, which is 80%. The details of the timetabling you can go to our MPH website. So now I go to the admission. So these are the important dates that you may want to pay attention to. So as you probably know, our application opened already starting on 3rd of November last year. And then for the application deadline for the early decision, we will be February this year. And for the main round application deadline, and all the local applicants, the deadline the April 30th this year. And we also have hearing round for our local student, which is in June, end of June, and also for our integrated program students who are taking a year enrichment year at the age with us. For the applicants, all the applications will be reviewed and shortlisted. For those who are shortlisted, you're invited to a Zoom interview, and by one of our concentration leads. And then after that, the recommendation will be reviewed by the MPH board body, followed by the faculty and the registrar. And our admission decisions are made on rolling basis. So if you are interested to join, you should consider to apply as early as possible. So this is the interface of the online application. So please make sure you click the right one. So you need to actually look for the September 2026 admission, and then you can check your eligibility in terms of the general regulation, also the regulation for the third court PGS program as well. So make sure that you look at the eligibility. If you have any questions, you can always contact our MPH office. We will answer the question for you. Okay, so this slide some of the supporting documents. So in addition online application form, you should submit your transcript, your graduation certificate or proof. Please make sure that you have those documents early as possible, because we need those documents to verify your qualification. And you can also submit your report. Also, optionally, if you have a CV that you would like to share, you can also send it to it as well. And any other supporting you think benefit will help us to actually understand you more, then please submit, like for example, your award scholarship as well. And for those who are required to demonstrate your English proficiency, making sure that you submit the information and document for us as well. And for also make sure that you complete the online education with China, higher education of student academic transcripts. This will be applicable for the mainland student who are applying to our program, and also making sure that you complete the online verification report, the higher education qualification certificate if applicable, and also the higher education degree certificate as well. So this information show the course fees. So we have 1 year, as I mentioned, 1 year full time, 2 years time. We have two tiers fees. So one is for the local candidate and one for the local. So the local one is about roughly about 231,000 for the course fees, and for the non-local will be 264 for the course fee. And for the intercalated program, the 1 year time and fees are special arranged and will be partially funded by the Faculty of Medicine. So you will find the information through the T. The last one I want to say is the scholarship. So we actually have some scholarship available for students to apply, especially for those who are from the low income or low middle income countries. And so we have two scholarships, and the Chan Tong and Friends Global Community of Health for All Scholarship. And so for those, so the scholarship actually include to cover the tuition fees. Also, we will provide the stipend to support 1 year's living expenses in Hong Kong. We also provide the economy class return at the low cost between the scholars country residents and Hong Kong, and also 1 year's free accommodation as well. And the award actually on basis of academic merit and also the community service that you have done before. And the application deadline is April 30th this year. And for the other scholarship, also have a scholarship. Did I skip one? Oh, yeah. And then there's also one, it's the entrance scholarship for psychologists. This scholarship is one scholarship. And so specifically for us, a psychologist who want to pursue public health study with the aim of cancer care, especially focus on psychosocial cancer care provision. So for this particular scholarship, we will basically cover the tuition fees, and the award will be based on your training in relation to oncology. Okay. And we also have two other scholarship. One is the honorary teacher scholarship. We have two scholarship of $30,000 each, and the award is actually based on your academic merit, and also we also consider the non-academic achievement and especially community service. And we also have one scholarship which is the Professor Anthony Hadley Scholarship, which also in concept of $30,000, and the award also is based on your merit with consideration of non-academic achievement and also community service. But for this particular scholarship, the priority will be given to students who actually special interest in environmental health, and the application deadline will be the August 31st. And we also have another scholarship which is actually given covered by the UGC. So this is the Hong Kong Future Talent Scholar Scheme for studies. The aim is to actually attract locals to pursue interdisciplinary and in-depth postgraduate training in the priority as specified by the government. In this particular one, is promoting good health to Hong Kong and at the Greater Bay Area. And so starting last year, this is the second consecutive year that our MPH program have been selected by the UGC to be part of the scholarship scheme. And the success candidate will each receive an award of 100,000. And the application procedure then can be uh, you can find out the details from our website. And who will be eligible for the Future Talent Scholarship Scheme? So this scheme is only open to local students. So you have to be a Hong Kong resident in order to be eligible to apply. And so both full-time or part-time students are eligible. And they're admitted to the program. You have to accept the admission offer with the deposit paid by end of June in order to be considered for this application. And also, when apply, you have to submit a proposal to specify your commitment, also your plan to contribute to the priority area. So in this case, will be healthy living and also caring community upon after you graduate. And also, you need to submit as if you do, you get the award, and you also have to complete a summary of your contribution to Hong Kong after you graduate and how it's and its relevant program too. And this is a mandatory return, and you have to submit the summary within months after the end of your last semester of the study. If you don't submit the summary, you will be asked to pay back for the fees. So the assessment criteria for this particular scholarship will be based on the academic achievement and also your professional qualification, relevant working experience, as well as your previous achievement in other areas, and also how well comprehensive your proposal submitted at the application. So if you want more information, please stay connected with us, and you can visit our website and also our social media platform. You can go look it up at us as Instagram. And also, you can obviously contact our MPH office or myself or Dolly Wong. And that's it. Thank you very much.
Thank you. So if there are any questions that we haven't answered in the Q&A, please use the Q&A, or if you have any questions that you would like to ask us, we will be here to answer questions. Okay, we'll answer that. We have a question. Can you elaborate on the admission requirement of a bachelor's degree without honors? I went to university in US, the equivalent standard. That's a Q&A.
It is necessary to have a civic level of honors for your bachelor degree, as we have the equivalent standard to transfer your GA over 4.2 in HKU standard. We will transfer. We will use the converted score.
I guess we don't see any questions in the chat box. So you can always if you don't have a question at the moment, it's okay. You can always email us later on if you do have. So we will stay here for a while, and then if you don't have any more questions, we will end the session. And you can contact us later on. Thank you. Okay, so thank you very much for attending the session. Thank you.
Thank you.